Can you provide an overview of your research on immunophenotyping and its significance in understanding immune cell subsets and their functions?
Well, the question is very interesting, and the answer would be very, very long. I try to short as much as possible. I mean, we have to unravel the interactions between immune cells and all the other cell types. And for this reason, it is crucial to know perfectly which populations we are coping with. I mean, so immune phenotype is a sort of technology, a sort of philosophy, I would say, that allows you to identify in details the cells of the immune system. It is something quite complicated at the moment because when we started to work, maybe 40 years ago, phenotype was just CD3, CD4, CD8 or something like that, very simple. We used fluorescent microscopes. We used the first flow cytometers that had very few parameters. If you could do two-color flow cytometry and identify CD4 and CD8 in the same tube, it was really something. Then, at the end of the 80s, we had another color, another possibility to implement and increase the number of parameters, then up to 4, 5, 10, whatever colors. And now we have a huge amount of possibilities to identify in details all cell populations, and we can perform studies that allow to put together phenotype, function, activity, cytokines, and whatever. So I think that this is a very interesting way of thinking that will change our view on the immune system and immune cells.
What would you say are the major challenges these days to generate information through immunophenotyping?
There are many challenges. It's difficult to give an answer, a precise answer, because challenges go from the instruments to the reagents to the technologies used to the operator. So the main challenge is to have the right protocol with the right reagents, with the right instrument and the right people, and finally the right way of analyzing data. Because nowadays, as I mentioned, we have the possibility to put up to maybe 40 or 50 antibodies to analyze one single tube. So it means that, simply speaking, if you have a marker which is positive or negative, you have 2 to the 50th possible different populations, which is an incredible number. So this is just the theoretical possibility to find a given phenotype. But what I want to say is that the main challenge that we have is to find good reagents, very clear-cut, high sensitivity instruments that are affordable, which is sometimes a real problem, and people who are able to do in a correct way the analysis of the samples that they have in their hands.
In the context of COVID-19, what have we learned about immune responses and the role of immune cells in disease severity and long-term complications?
COVID-19 was something unforgettable for everybody. What we learned is that, first of all, the scientific community has to act like a unique body, and people have to share knowledge, have to share skills, and this was done in the very first months of the pandemic, where really immunologists and people doing also other disciplines were working together to fight this pandemic. We have learned a lot, I think. We have learned that, first of all, we can save millions of lives with vaccination, and the campaign of vaccination was something unbelievable. I recall all the times that the virus was cloned on January the 10th, 2020, and the first vaccine was ready, in experimental way, of course, was ready by the end of February, after 6 weeks. So it means that we have now the possibility to create vaccines starting from the sequence of the virus in a very short period, and these vaccines work. And what is important is to underline that the community of immunologists was able to show how this can happen and show how the immune system reacts not only to the virus but also to the vaccine. I want to say that The first phase was that in which we have to understand how the virus works and how the virus is dangerous for the body and how the immune system reacts. The first point, the first thing to do were to understand this and to find solutions. To find solutions to block the immune activation, to block the hyperinflammation, and this was done either with anti-inflammatory drugs, but also with biological drugs. I remember the story of tocilizumab, which is an anti-interleukin 6 receptor biological drug that was able to reduce in a very significant way the mortality and the mechanical ventilation in a number of patients. But after the first phase, in which we understood how the immune system reacts, there is a second phase which is still ongoing, and this phase is the one in which we have to realize how vaccine works and which people have to be vaccinated and for how long and how many times, and we have to understand that there are persons who are fragile and require a continuous monitoring of their immune system to cope with the virus, and this is something that we have learned to do and we are continuously doing now, monitoring the immune response in people of all kinds.
How do you envision the future of immunology research, particularly in the context of advancing our knowledge of immune cell subsets and their functions?
I think that one of the main problems that we have and that we have to solve is to homogenize the studies on immune phenotypes and to try to use protocols which are similar all over the world in order to study the same things in the same way and to have reproducible results. I mean, what we are seeing now is the onset of thousands and thousands and thousands of different phenotypes, on different cell populations that are analyzed in perfect manners, but with different reagents or different protocols. So what would be important, in my opinion, is to homogenize everything and to have the same protocols used in different settings. If you want to study a type of cell in cancer, in autoimmunity, in infections, you need to have the same protocol and the same kind of approach to that kind of cell. If not, we will never understand. It is like when we started to do immunology many years ago. I mean, when we started to have the anti-monoclonal antibodies and the CT classification, a number of laboratories were preparing antibodies with a different name, but all the antibodies were recognizing the same molecule. So there were workshops to decide which was the molecule and which is the name of the antibody. In other words, in that period, I'm talking about maybe 35, 40 years ago, even more, the community of immunologists was looking for a common language, and to have a common language is something that we really need in this moment in which the technologies allow to measure and to identify an incredible high number of cell types. But these cell types are not infinite. I mean, they will stop, and there should be a definite number, a final number of possible phenotypes, and what we have to do is to find the way to reach this number in a very correct way and possibly in the same manner all over the world.